I just want to briefly run through the G5 ventilator in the neonatal setting. The two that I have over here will be labeled NICU. You can pull the other vents at any time. You would just have to change some of the settings. So these ones have been configured to default to the neonatal population. And then we also have leak compensation, or I'm sorry, not leak compensation, leak percentage that we can monitor just based on what the baby's leak is. In terms of the circuit, the flow sensor looks just like the other one except it's smaller. And then the little adapter to do the flow sensor check is skinnier and longer. One reminder, if we were going to put the baby in RAM in the nasal CPAP mode, we would just want to move the flow sensor from up here to down here. It's just a little too sensitive in that mode, so we're going to be measuring exhale to tidal volumes. So we're putting it on the expiratory side there. If you do move it to that side, you just want to do another flow sensor check on it. Pre-op check is going to look the same. I just did all three of them and they passed. One thing to be mindful of is the tightness. You kind of have to really tighten everything on there for it to pass. I just kind of squeezed everything together really tight and it passed the first time, no problem. One of the things I added here was this ventilator cheat sheet. Dr. Grebe, the medical director, just asked that we switch to using more APV-CMV versus SIMV pressure control. And then there's your target ranges there. One of the things the neonatologist just mentioned to me, if you do start them in this mode, we do have the volume limit, which you would want to verify with them, but we don't have the target limit under controls. I did tell her it's controlled by our alarms. It's 10 below whatever our pressure setting is. So that's something that we would just need to verify with our provider as well, is what we want that pressure limit to be since we're now in a volume targeted mode. And under controls, as long as you put your kilos in correctly under that initial screen, when you go to titrate your volume target, it will change your mLs per kilo there. There you have another option to change your patient weight. And then whenever you turn your AT tube compensation on, you just want to put your size there, and it does default to 80%. But something I learned recently on the neonatal and the adult population, when you set this, you want it to create as much of a square waveform as possible rather than having a pressure overshoot, which would be a spike right at the top of the breath. So if you start to see that, you may want to go down on your percentage a little bit. And then if you're going to do nasal CPAP, you can do RAM cannula on this setup, and you can also do the trunk that we do for bubble CPAP if we need to get a better seal and deliver that pressure more effectively. If you turn the pressure support off, they'll no longer get that backup rate. It'll go to gray there, and this would be just like doing 5 of CPAP. In terms of the flow trigger, you may have to start a little lower. It will default here just based on recommended settings from Hamilton, but you may need to go down on it in case your patient has some missed triggers. The other thing is if you do have a large leak, you're actually going to want to go up a little bit on your ETS percentage so that it triggers into exhalation sooner. And just a reminder, that is saying that at 40% of peak inspiratory flow, it'll trigger into exhalation. So if we wait until 25% of that flow, it'll take longer to trigger into exhalation phase. One thing you can do to overcome that and not have to worry so much about that is to set your TI max only 0.1 above what your TI is set to. Here it also shows you a picture to remind you to switch your flow sensor to that expiratory side and do a pre-use check after you've done that. If you are to use the ventilator cheat sheet and pull it off, it's just connected by Velcro over here. So just gotta make sure you reattach that so it stays with the vent. And then we do have the neonatal flow sensors stocked now, just in this box here, and we're just waiting to get that added to the actual PAR in the clean utility room.